Hi there. Let me talk about a very important topic today, which is associated with lots of myths and misconceptions. The topic of regional anesthesia, particularly spinal anesthesia. Now, before I go into the regional anesthesia bit, let me talk about the general anesthesia. What is actually general anesthesia? Here, you put the patient completely to sleep. Now, there's a very interesting quote by Robin Cook, the medical fiction writer, about general anesthesia. He had written in one of his books that anesthesia is a criminal assault which is legally protected. It actually is. When you put a patient to completely sleep, that is general anesthesia, then the patient is actually virtually almost dead, and any assault can be done on that patient. It's a very, very dangerous procedure. One day I'll talk about in details about general anesthesia, but in nutshell, I want to tell what happens in general anesthesia. In this, certain medicines are injected into the patient, by which the patient loses all the consciousness, her respiration stops, her all reflexes are gone. So she's totally at mercy of the doctors. And until the tube, endotracheal tube it's called, is put inside her lungs, she's on zero oxygen. And if you have problem with putting in the endotracheal tube, then the patient can die of cardiac arrest any moment. And all over the world, the maternal mortality, the maternal deaths which have happened during cesarean sections are commonly caused by the complications of general anesthesia. So when I went to England, I saw that all the elective cesarean sections are being done by spinal anesthesia. I was a little surprised. This was not the practice that time in India. This is because it is much more safer. Here, the patient is conscious, the patient is breathing herself, all her reflexes are there. So, she can cough out anything, she can tell what she's feeling like. If she's not unwell, she can tell the doctors, the machines are monitoring her, and so we can take the steps. Induction of general anesthesia in case of a pregnant patient is particularly dangerous. It's far more dangerous than a non-pregnant woman. This is because there are certain physiological changes in the pregnancy. There is bending of the spines and there is abdominal swelling. So sometimes this intubation, putting in the endotracheal tube, is really, really difficult. And if it happens that the anesthetist is having trouble with intubation, the oxygen saturation of the patient can drop drastically down. I have seen these case like this once where the saturation dropped to 50, then 40, then 30%. Now at 30%, at that low saturation, cardiac arrest can happen anytime. Fortunately, finally, the anesthetist could intubate and the saturation came up. So why take the risk? Why not opt for a much safer procedure, which is regional anesthesia, which is in case of cesarean section, spinal anesthesia. Spinal anesthesia is a procedure by which a local numbing drug, local anesthetic drug is injected to the spine of the patient, which numbs the sensory as well as the motor fibers. So there is relief from pain. Now, to explain, what are the different sensations we feel? There are only 4 types of sensations: pain, temperature, touch, vibration. Once the spinal anesthesia is done, the pain, temperature sensation almost immediately gone. The touch sensation will remain, and most of my patients exclaim while I touch them after the spinal anesthesia is complete, "Oh doctor, I can feel it, I can feel your touch." Yes, you will feel, but you won't feel the pain. That's the advantage. Touch also goes, but by the time the touch goes off, the operation is normally finished. Now, this spinal anesthesia effect will remain for about a couple of hours, a little bit more, a little bit less. Now, that's enough time to complete a cesarean section. So the bottom line is, for cesarean section, the procedure of spinal anesthesia is a far, far safer option than general anesthesia. There are few conditions where we cannot give spinal anesthesia. Those are rare, but we would always prefer a spinal anesthesia for elective cesarean sections. When I came back from England, there were not much people who were giving spinal anesthesia. Now, almost all the good anesthetists prefer spinal anesthesia in cesarean sections. If you take certain precautions, spinal anesthesia will rarely cause any death or fetal accident. And because it does not cause the nausea and vomiting or the grogginess associated with general anesthesia, you can start oral fluids and food much earlier in a postoperative patient. So usually, I always prefer spinal anesthesia unless there are certain conditions which bars or which bar from giving it. Many of my patients tell, oh, doctor, spinal anesthesia causes a lot of backache throughout their life. How can you get backache throughout your life? A simple injection, like an injection given in your hand or in your back, that sort of injection continue to give you pain throughout your life? Similar small needle goes in. And the other argument the anesthetists tell that this sort of injections, these sort of joint injections are often given when there are joint pain to relieve the joint pains. So if an injection is often used to relieve the joint pains, how can it give pain for throughout their lives? What happens is that now after the childbirth, it's a back-breaking job for the mother. So that lot of exertion, breastfeeding, sitting tight for a long time, keeping the baby on the lap for a long time, she may feel that I'm feeling the pain on that area where the spinal injection was given. But I tell you, most of my patients, almost 100% of my patients, never complains after 1 year. So I will always go for this safe procedure for my patients. Now, after hearing this video, you can go ahead and watch the real-time video of a spinal injections being given. It's brilliantly done by a brilliant anesthetist on one of my patients years ago. Now, how do you know that you have gone into the spinal space? That's a beautiful thing. Once the needle goes into the spinal space, clear water-like droplets starts coming out. This is known as the cerebrospinal fluid. And this, our brain and the spinal cord is being immersed in this cerebrospinal fluid. Once the needle hits that area, the anesthetist knows that he has reached the right area, and he gives the numbing injection and put the patient on the table in a horizontal position. So this numbing effect numbs all the nerves which causes the pain. Go and watch the method, how it's given. Now here, actually what we do is that we cover the back with a green sheet, and only there is a hole through which the injection is given. Here this sheet is not given so that you can also know actually where this injection is being given. Go and watch it, and always remember, this is the safest option for cesarean sections. Anesthesia is a serious business. We should not take it lightly. Human life should never be taken lightly.